Medication management. We will look at the practice issues for health and social care workers, namely the guidance from the Royal Pharmaceutical Society's 8 principles. Best practice in sourcing, administering, recording and disposing of medicines. Issues around choice and consent. 8 principles of safe and appropriate handling of medicines. Access to pharmacist. The service has access to advice from a pharmacist. There will be a source of expert advice on medicines, their effects and side effects. For the right reasons, medicines are used to cure or prevent disease or to relieve symptoms and not to punish or control behavior. Medicines must be used as prescribed. Freedom of choice. People who use social care services have freedom of choice in relation to their provider of pharmaceutical care and services and should consent to receiving medicine from trained staff, where appropriate. Service users may choose to look after their own medicines. Hence, personal and cultural preferences should be accommodated. Stored safely. Medicines must be stored safely. Store in a suitable, secure environment. Safeguards must be in place to protect against theft and mixing up of medications. Medicines known and recorded. Carers or health workers should know which medicines each person has, and the care service must keep a complete account of medicines. Staff should know what medicines are prescribed, how they should be administered, and what condition the medication are used to treat. Staff must monitor self-administration of medication in their service, as well as prompting and giving of medicines. Services should record all medicines acquired, used, and disposed. Readily available. Medicines should be available when the client or service user needs them. The care provider should make sure that unwanted medicines are disposed of safely. Medicine supply must be managed to ensure continuity of treatment. Unwanted medicines should be disposed of safely, safe and dignified. Medicines must be given safely and correctly. Carers must preserve the dignity, privacy and confidentiality of their client when they give them medicines. Right medicine must be given at the right time and in the right way. Services should provide written procedures supported through supervision. Competent carers or support staff who help people with their medicines must be competent and are required to have regular medication training and must demonstrate their knowledge. Services should not assume competency of their carers. Obtaining supplies of medicines prescriptions. In the context of health and social care, medication is likely to be ongoing, and therefore prescriptions of a repeat nature. Repeat prescriptions. This can come from the GP surgery or through the pharmacy collection service. GP surgery. Establish the surgery's turnaround time for processing a request. Take care not to overorder. Check prescriptions received against original request list and highlight any discrepancies with GP. Pharmacy. Allow time for prescriptions to be received, medication prepared and delivered. Check dispense medication against the prescription details. Provide medication details and subsequent updates of any individuals having medicines administered by support staff. Acute medicines, new or one-off prescriptions obtained as and when needed. Treatment, usually for a specified period such as 5 to 7 days, requires a separate process to that of managing repeat prescriptions. Storage of medicines. In any service where support staff administer medicines, policies and procedures must be followed. Medicines can be stored in individuals' rooms, which is important for those who manage their own medication, in suitable, accessible, secure cupboards that are used only for the storage of medicines and not with other possessions or valuables. Key security. Only authorized support staff can access medicines and includes keys being held separately to the master system. A procedure must be in place for key holders, which will include actions to be taken in the event that keys go missing. Refrigerated storage. Refrigerated storage of some medicines is indicated on the patient information leaflet that is supplied with the medicine. The fridge should be separate to the main food storage fridge, secure, lockable, monitored and recorded daily for the right temperature, cleaned and defrosted regularly. Medicines administration. To give medicines safely, you will need to ensure that the medicine pack have a label attached by a pharmacist or dispensing GP. Identify the named person the medicine has been prescribed for. Know the purpose and effect of the medicine. Be aware of any special instructions associated with safe administration, e.g., must be taken with food, i.e., before food or after food. Have a written procedure to refer to. Ensure that staff adhere to the procedure. The Medicines Act 1968. Under the Medicines Act 1968, trained staff can administer tablets, capsules and oral mixtures, medicated creams or ointments, ear, nose or eye drops, inhaled medications. Specialist training trained staff will require additional specialist training to administer suppositories, injectables, percutaneous endoscopic gastrostomy, PEG, or feeding tube, oxygen. Medication administration records, MAR. MAR sheets are required in every social care setting where support staff give medicines. The MAR sheet provided by a pharmacist or GP must detail which medicines are prescribed for a person, when they must be given, what the dose is, and any special information such as with meals making references to the information provided. MAR sheet can be used to record receipt and disposal of medicines, detailing date, name and strength of medicine, quantity, person prescribed for, signature of staff member. The 5 R's of medication administration, right person. How do you know? Do the records match? Check the label on medication and MR sheet right medicine. Check expiry dates. Check strengths. Do the records match right route to be taken or applied? Do you have the right level of competency? Additional materials required. Right dose. Are instructions clear? Has dose been changed? Is it the right number of tablets, right time? Is it the right time? Record dosage taken on MAR sheet. Should they be given before or after food? How often should they be given? Good practice. Medicines must be administered to the person intended and for the purpose intended. Medicines must be dispensed from the original container and not transferred into a secondary dispenser. Refusal to accept prescribed medication should be recorded on the medication MR sheet. Staff should immediately report, record, and investigate any errors in prescribing, dispensing, or administering medicines. Immediately report any adverse reactions to new medication to the line manager. Record-keeping dues. Record what you do when you do it. Record clearly, completely, legibly. Record in writing using black ink with entries dated and signed. Hold up-to-date details of each medicine for each person. Use support plans to advise whether a person self-manage or requires assistance to administer their medication. Don'ts. Rely on your memory and record at a later time. Record giving medicines at the preparation stage in case they are refused and therefore not actually taken as recorded. A signature on a MAR sheet means you have seen the person take the medication. Situations requiring special consideration. A client or patient arrives with a supply from a previous care setting. Long lists of prescribed medicines. Mixture of regular and specific medicines. Label saying "take as directed" misunderstood. Multiple prescribers, doctors, nurses, dentists. Surplus medicines hoarded. Mixture of prescribed and complementary medicines. Introduction of new medicine or a change in dose. Disposal of medicines. Disposal refers to the removal from residential care settings of surplus, damaged or expired medicines in line with the stated policy and waste management guidelines. In care homes with nursing in England, this means using a licensed waste management company. Controlled drugs. Controlled drugs, CDs, are prescribed medicines with additional requirements for storage, administration, recording and disposal due to the associated risk of misuse. Sourcing. CDs are prescribed and dispensed like other medicines, though the process may take longer due to additional legal requirements. Support staff may be asked for proof of identification when collecting CDs on someone's behalf. Administration. It is essential to involve a second, suitably trained worker to act as a witness. CD administration should be recorded per CD, per person in a hardbound numbered register. with details duplicated on the mark sheet. Any stock remaining should be checked against the recorded balance every time the medication is administered. Storage in designated secure cupboards that comply with the storage provisions of the Misuse of Drugs Regulations 1973, namely secure cupboard but also secure location, e.g. a double-locked cupboard. Careful control of key holders. Personal lockable cupboard for self-managing individuals in residential care. Disposal. Nursing homes may need to treat CDs using custom kits before arranging collection from licensed waste management company. Other social care settings should return to source, pharmacist or dispensing GP, requesting a signed receipt and logging an entry in the CD hardbound numbered register. All disposals should involve 2 members of staff. Good practice. Check with pharmacist or dispensing doctor if you are unsure whether a drug is a CD. Record new arrivals of CDs. Do not label CD cupboard. Do not cross out or delete entries in the CD record book. Use footnotes or marginal notes and ensure they are signed and dated. Self-administration. Self-administration should be encouraged as part of promoting independence. Self-administration can be in part or in full. For example, someone self-administering some medicines but requiring support for others, or part self-administering medicines but requiring support to complete the administration process. Risk assessment is important to control against misuse of medicines, particularly in residential settings. This process involves determining whether the person can self-manage or requires support, making people aware of their medicines, what they are, their effects, the possible effect of not taking them, and how and when to take. Communicating the importance of storing medicines securely. An individual's care plan should record the level of support required and thus the role and responsibility of support staff in the process. It should also detail a process for monitoring and reviewing self-administration, as changes in a person's ability to self-manage could result in prescribed medicines not being taken. Choice and consent. Individuals in receipt of care may require more information before giving consent and making a choice about medication. Consent may be influenced by an individual's cultural or religious beliefs. Individuals who lack capacity to consent are covered by the provisions of the Mental Capacity Act, and decisions will be taken in their best interests. Vegetarians may resist gelatine capsules derived from animals. Muslims may be concerned about medicines containing unclean substances. Some religions practice periods of fasting. Covert administration of medicines. Where individuals lack capacity to consent to receiving prescribed medication, resist the prescribed medication, and it is deemed in their best interests to take it, it may be administered covertly by disguising it in food or drinks. Such covert administration must be considered against the legal and best practice frameworks to protect the individual, staff, and the service. Over-the-counter remedies. Over-the-counter remedies, also referred to as homely remedies, are not prescribed and therefore outside the provisions of the Medicines Act. These medicines are used to treat minor ailments. Care services should consider the following points before administering over-the-counter medicines. Seek advice from medical professionals. Set guidelines for staff, including what they can and cannot treat. Choose medicines suitable to the age range. Communicate policy to service users, families, and relevant medical professionals. Record receipt, administration, and disposal, as with other medicines. Some complementary medicines and supplements may affect functioning of prescribed medicines. Relatives may supply homely remedies to an individual in residential care. Legislations to guide the practice of health and social care professionals. In this section, we will review the legislation in place that set the standards and guide the practice of health and social care professionals. We will consider secondary legislation and guidance and list the local policies and procedures to be found in the workplace. Medicines Act 1968. Governing the manufacture and supply of medicine and deferring to the Misuse of Drugs Act for prosecutions, this act identified 3 categories of medicine: prescription-only medicines, POM, from a pharmacy requiring a prescription. Pharmacy medicines, P, from a pharmacy not requiring a prescription. General sales list, GSL, from any retailer not requiring a prescription. Misuse of Drugs Act 1971. This is the principal legislation and covers production, supply and possession of controlled substances. It details classification A, B and C, penalties, caution, fine, imprisonment, proportionate to classification. Health and Social Care Act 2008. Regulations 13 and 23 are of particular importance for health and social care professionals. Compliance guidance on these and all regulations and their associated outcomes is provided by the Care Quality Commission, CQC, and is located in the Resources section of this course. Regulation 13, Outcome 9. You must protect service users against the risks associated with the unsafe use and management of medicines through appropriate obtaining, recording, handling, using, safekeeping, dispensing, safe administration, and disposal of medicines used for the purpose of the regulated activity. Regulation 23, Outcome 14. Persons employed for the purposes of carrying on the regulated activity must be supported in relation to their responsibilities to enable them to deliver care and treatment to service users safely and to an appropriate standard, including by receiving training, professional development, supervision and appraisal, being enabled to obtain further appropriate qualifications. Where the regulated activity involves the provision of healthcare, the registered person must, as part of a system of clinical governance and audit, ensure that healthcare professionals are enabled to provide evidence to their relevant professional body demonstrating that they are professionally compliant. System of clinical governance and audit means a framework through which the registered person endeavors continuously to evaluate and improve the quality of the services provided, safeguarding high standards of care by creating an environment in which clinical excellence can flourish. Related legislation and guidance. The following are lists of related legislation and guidance. Administration and control of medicines in care homes. Royal Pharmaceutical Society of Great Britain, 2003. Hazardous Waste Regulations, 2005. Safe Disposal of Medicines. Control of Substances Hazardous to Health, COSHH Regulations, 2002. Health and Safety at Work, Act 1974. Mental Capacity Act, 2007. Data Protection Act, 1998. Confidentiality of Information. Nursing and Midwifery Council, NMC Standards for Medicines Management, 2010. Local policies and procedures. Medication, substance misuse, safeguarding, Mental Capacity Act, deprivation of liberty, safeguards, risk assessment, data protection and confidentiality, whistleblowing. Thanks for watching. Please share, like and subscribe to this channel so we would be motivated to bring you more of such educative videos.